Hello, my name is Erika Saucedo. I'm a board certified ophthalmologist, and I'm making this video in response to a very sweet girl who could not believe I was 50. Thank you so much for that compliment I receive. And she was asking my supplement regimen, so I'm going to go through that. The first supplement is omega-3s. This is something that I take as well as recommend for my patients. The omega-3 is a essential amino acid, essential fatty acid. Essential just means that we can't get it from our own body, so we have to get it from an outside source, food or supplement. And I just find that it's difficult for me to get enough omega-3s in my diet. That's why I supplement. But sources of omega-3s are fatty fish like tuna, salmon, mackerel, nuts like walnuts, chia seeds, flax seeds, and avocados. The brand that I take is Momentous. For those of you that know Andrew Huberman, he's a PhD in neurology as well as ophthalmology. He recommends this brand, and I looked into it, very high quality, and they get their omega-3s from wild caught in Norway. So if you are vegan, omega-3s may be not the best source for you as far as fish, right? So you could consider maybe the nuts or seeds. And the reason I take omega-3 is a benefit. So starting with the brain, it helps with memory, helps with learning, helps with blood flow to the brain, also helps with something called abstract reasoning, which is understanding complex concepts through logical thinking. Try to say that fast. Just kidding. Anyway, but that's what a benefit of omega-3s. And it's also been shown to be beneficial for patients who are at risk for Alzheimer's. Dr. Rhonda Patrick, she's a PhD, has a ton of information on this. I'll put links below. Also, an amazing person to check out. She has a lot of studies on this, but there are patients who are carriers of the APOE4 gene, and these patients are at higher risk, much higher risk for developing Alzheimer's, and it's been shown that these patients taking omega-3s can decrease their risk. As far as for people without that gene or without being carriers, it does help in preventing dementia. Another benefit moving down is the eyes. That's where I focus. The patients that I recommend omega-3s for are patients who have dry eyes, and typical dose is that I recommend is 3,000 milligrams. The average dose you get from, for example, Momentous, they recommend is about 2,000 milligrams. So just depends on what area you're looking to treat. As far as for treating Alzheimer's, I think it's much higher. But it's been shown to be beneficial for dry eyes at about 3,000 milligrams. Moving down, cardiovascular benefits, it's been shown to be beneficial for increased cholesterol, and doctors are actually now prescribing omega-3s at about 4,000 milligrams. So you can see there's a little bit of range depending on what you want to treat. But it has been shown to decrease our triglycerides, decrease our LDL, which is considered the bad cholesterol, and increase the HDL, which is considered the better cholesterol. Also been shown to lower blood pressure. So a lot of benefits cardiovascular wise. Okay, sorry, I forgot to silence my phone. Next supplement, vitamin D. 42% of adult Americans are vitamin D deficient. Vitamin D is essential, again, meaning we have to get it from an outside source, fat-soluble vitamin. The way that I think about it is you have your fat-soluble vitamins, DECA, D, E, K, and A, and you have your water-soluble vitamins. So, for example, vitamin C. Water-soluble vitamins you cannot overdose on because if you take excess, you'll just pee it out. Fat-soluble vitamins, unfortunately, can be overdosed on, but when I looked up the amount you need to be taking to actually overdose, it's quite a bit, 60,000 international units of vitamin D, and that would be daily for several months in order to reach toxicity. The recommended dose for vitamin D is typically anywhere between 2,000 to 5,000 international units. So I think taking the vitamin D supplement, very low risk of getting toxicity. However, if you're able to go to your doctor and get your vitamin D levels checked, that's probably the best way to make sure that you are actually vitamin D deficient. But if not, I still think taking the supplement is beneficial in my humble opinion. So what are the benefits? Something that people don't realize is vitamin D is a hormone. So what is a hormone, right? We usually think of our sex hormones. Well, hormones are basically little chemical messengers that go to the cells and the organs and tell them what to do, right? So we think of it like, it tells our reproductive organs what to do, but it also, think of it, it goes to other places like the brain. So it can help our mood or not help our mood, depending on which hormone we're talking about. And so that's what vitamin D is. It's a hormone. So that means that it's a chemical messenger to our cells and organs. So the benefits of it is, first thing that most people know about is calcium absorption. It helps with calcium absorption. So especially patients that are older who are at a risk of osteoporosis, it's an important vitamin for bones and teeth. But also there have been studies looking at younger women, and well, I guess I'm not younger anymore, but younger women, like 18 years and over 18, have been shown to be deficient in calcium as well as vitamin D, which is kind of surprising. And so unfortunately that puts us at risk for weaker bones and teeth. I keep saying us like I'm part of it, but we'll just go with that. Also helps muscle strength and power. Again, talking about vitamin D, it helps with muscle recovery. It also helps with sleep quality. And lastly, it helps with immune function. So you know how a lot of doctors were recommending during COVID to take vitamin D? It's because it helps your immune to help protect you from getting sick. Oh, actually, the very last thing is that it's neuroprotective, so it actually helps the brain. It's been associated with lowered cognitive decline, and it decreases oxidative stress. It regulates pathways for cognitive function, so in other words, thinking. And it also has been shown to clear the amyloid plaques. Amyloid plaques are something that you see in Alzheimer's disease, so a lot of benefits to vitamin D. The other thing I did want to mention is patients who are more heavily pigmented and obese patients tend to have lower levels of vitamin D. The heavily pigmented is because, if you think about it, if you're in the sun, they're not getting the absorption of the vitamin D, and so they tend to be lower. And then obese patients, because it's a fat soluble, tends to go into the fat cells or the fatty tissue, and so it's not available. So these patients, if you're in that category, would definitely benefit from vitamin D supplement, or more likely to be deficient. Okay, next supplement, a hair supplement. The one that I choose, which is not necessarily, there's so many good ones out there, but this is the one that I found was best for me and what I was looking for, is NUTRAFOL. A big disclaimer though, do not take this if you're trying to get pregnant or you are pregnant. And the reason for this is it has something in it called saw palmetto. Saw palmetto is a DHT inhibitor. So testosterone, which is an androgen hormone, gets converted to DHT, which is the stronger androgen hormone. And DHT has been shown to increase prostate size, so benign prostate hyperplasia that's seen in men, especially as they get older. But it's also been shown to increase male pattern baldness, but that's because it actually shrinks the follicle of the hair. So it is beneficial for women as well for hair. And so what saw palmetto does, that's in NUTRAFOL, is it blocks the 5-alpha reductase, which is converting the testosterone to DHT. So you're not getting as much DHT and you're getting less follicular shrinkage. So that's the mechanism there. The other thing that I like about NUTRAFOL specifically is it has ashwagandha. Ashwagandha has had a lot of studies on it and shown that it is quite beneficial for anxiety because it stabilizes your cortisol. So it's a calming effect. And if you're somebody who's a little more nervous or stressed out, this is a great supplement for you. And I like the fact that it's in the hair supplement, so I don't have to take it separately. The other thing that I think about is, so remember how I said that the saw palmetto blocks the testosterone from getting converted to DHT? So that means the DHT goes down, right? And the testosterone goes up. And so increased testosterone is actually a good thing because testosterone helps with bone density, muscle mass, right? Strength, libido. But also testosterone is an anxiolytic. In other words, it breaks or it decreases anxiety. And the way that I think of that is, you know, that picture that we've seen of like the rams and they're going at it? That is testosterone at its best. So that means that, think of it, those rams are like pumped full of testosterone. They are not anxious about anything. They are just going in there and getting it done. No second thoughts, no overthinking. That's the beauty of testosterone. Obviously, too much isn't a good thing, but that's kind of the idea is that it actually helps with anxiety. So by increasing your testosterone, it's actually a good thing. And it's also been shown to be beneficial for sleep as well. So that is the NUTRAFOL supplement. That's the one that I take, the hair supplement. Next supplement, creatinine monohydrate, been studied many, many times. Most people think of this with bodybuilders. To be very honest, about over a year ago, I started training with a personal trainer, and she recommended creatinine. And so when I looked it up, I was so impressed by the benefits, not just the muscle benefits, but just to go through that. Oh, before I do that, so creatinine monohydrate is an amino acid that occurs naturally in our body, right? So we don't necessarily have to take it, but it has been shown to be beneficial for energy, right? So energy production. It basically boosts the phosphate reserves, and which is needed to make ATP. And ATP is our energy that we use in our cells. So this is an amino acid which is naturally found in our skeletal muscle, which helps boost the phosphate, which helps increase our ATP and energy. And what does that do? That helps with muscle mass, helps actually been shown to be beneficial for tolerance to more intense activities, and also helps with recovery. So it decreases cramping by decreasing dehydration. But the other benefit to creatinine, which I was very excited about, was specifically for women who are perimenopausal, so like before menopause or during menopause or after, and even pregnant women. It's been shown to be beneficial for the brain. So you know how women will say they have brain fog during menopause? This is what creatinine can help with. It basically helps with, sorry, my cats are fighting. Helps with mental cognition, it helps with memory, and it also helps with mood. So a lot of benefits to creatinine. Definitely would recommend for everyone. I don't see anyone who wouldn't be beneficial for. And the dose on that is I just take 5 milligrams. You can do, if you're really looking to, like for weightlifters, they'll do like a taper where I think they start at like 20 and then they decrease down to 15, 10, something like that, 5, and then stay at the 5. But I just started with 5 and I take 5 milligrams. Again, I will link I get creatinine from Momentous as well, but I'll link all the places that I get the creatinine from. The next one is astaxanthin. Astaxanthin is a carotenoid. A carotenoid is what gives plants and algae their color. So it's the pigment. It is an antioxidant. So in ophthalmology, we've done a lot of studies on age-related macular degeneration. That's a disease that affects the back part of the eye, specifically the central part of the back part of the eye. So the retina is the back part of the eyeball, and the central part is the macula. And so unfortunately, that's affected in macular degeneration, right? It degenerates too quickly and patients lose central vision. Devastating disease. Can be a devastating disease. However, carotenoids have been studied, as well as other supplements that have shown to be beneficial for preventing the progression of macular degeneration. So the specific carotenoids that we use in our eye vitamins, so for example, Preservision is an eye vitamin that doesn't just have carotenoids, but also has other vitamins. That's definitely been shown to be beneficial from preventing age-related macular degeneration. The carotenoids are zeaxanthin and lutein. So those are the ones that give plants their yellow pigment. But when I looked it up, astaxanthin, which is what gives algae and salmon their red color or pink color, has been shown to be 6,000 times more potent as an antioxidant compared to vitamin C. So it's super potent, also beneficial for the eyes, but it also helps with other things. So astaxanthin is thought to be an oral sunblock, helps skin, right? So just think of it like it's preventing the free radicals, and it's an antioxidant from forming. So in this case, it's helping with skin damage. And so I really liked that. The other things I liked is that, interesting, it helped hand-eye coordination. They truly did studies on this, which is so interesting. And as a surgeon, I will take that. Thank you so much. So the benefits of astaxanthin, eyes, skin, oral sunblock, hand-eye coordination, also help decrease Alzheimer's, increase athletic performance, and decrease joint pain and muscle stress. So excellent supplement, which is why I take it. Okay, the last one is NMN and resveratrol. I take them together. So NMN, again, is the precursor to NAD. So you need NMN to make NAD. And NAD is almost like ATP, right? Like it's helpful for cellular energy. And as we get older, our NAD goes down. So the idea is taking NMN, you're going to make more NAD and you'll have more energy. The resveratrol is why people say drinking red wine is beneficial, because it's found in the skin of dark grapes. And resveratrol activates the sirtuin enzymes. I know this might be more than you want to know. Dr. David Sinclair, another person I would highly recommend to look up, has a ton of studies on this, super interesting. I know that he himself takes resveratrol and NMN, but I don't know if he recommends it, but I know that he takes it himself. Anyway, so what the sirtuins do is they regulate like all survival and lifespan. So in the studies, the sirtuin enzymes increase the lifespan of yeast, flies, and mice. I don't know, to be honest, if it's been studied in humans yet, but it has been shown to be beneficial for lowering the heart and skeletal muscle aging in humans. And it's also been shown to be beneficial in boosting memory. So the reason I take them together is that together they both improve cognition by removing senescent cells, which are just basically old cells that aren't functioning well. That is it. I was trying to keep it brief. That's a list of all of them. And again, I will put the links below. Thank you so much for your time. I hope you're having a great day. Bye.